Good morning. It's Dr. Tom Iannello here from North Iowa Wellness Center. I'm sitting here with Linda. Linda has been a patient of ours for about a month and a half now. We had the opportunity to meet Linda through a referral from another patient. And when Linda came in, you had some primary complaints that were affecting you. Why don't you tell a little bit about your story, Linda?
Well, I tell you, when I walked in here the first day, I was close to tears because I was in such pain. I had pain in the back of my neck. I wasn't sleeping. I mean, I had to like force myself to go to sleep every night. I had pain in my right leg, the upper part of my leg, in the joint of my leg. So therefore, I could not even get out of the car, and I could not even get up when you called me into the room. Um, I was just in pain, and I just thought that my life was over. I thought I was really dying.
Sorry to hear that.
You know.
But interestingly enough, back it up a little bit. You had now Linda's the type of woman doesn't like to take drugs, has been natural most of her life in terms of how she lived, but ended up in a hospital on testing. So tell that story a little. What happened?
Yes. Well, last summer, it was August of 2013. I had a cold all summer, and I was just coughing profusely. I just could not stop coughing. I coughed so much that my whole body shook. And my husband is a retired military. I was leaving the military base on August 23rd, and all of a sudden, my right side, I got numb, and my foot curled up. I mean, I thought I was having a stroke. And reluctantly, I just said, take me to the emergency, because I didn't know what was happening to me. And when I got there, of course, from the coughing, it brought on asthma, symptoms. And of course, they gave me the albuterol. And the albuterol, of course, while I was there, it caused my heart to speed up. And then they said my heart went into AFib. As a result of that, they put me on medication for AFib.
You can tell Linda's not very happy about it.
I am not happy at all, because, I mean, they will kill you. I mean, I came in with a cold. I came in because my foot was curling up. But really, I do feel in my heart it was due to the nerve damage of just coughing so much. My body was just in shock, It was maybe a pinched nerve.
Now, what's interesting, not to cut you off, relax, Linda, it's good.
I'm just talking about it.
Don't get upset. You're having a nice day. So what's interesting is Linda came and told me her story, and she was so upset because you could see she doesn't like to use medication. Now, Linda, would you mind if I asked you your age?
No, I don't.
Would you mind telling them how old you are?
I'll be 65.
Right, so she's a young 65. You would have never thought this woman is 65, and that's why I wanted her to tell you that, because she looks this way because she doesn't use medication, and she lives well and she eats well. So she came in, and let me tell you what we found on exam. She had pesticide poisoning. Well, that's what we found. Nobody found pesticide. We found chemical toxicity from pesticides that's floating around her body. And due to that, her adrenal system was under duress and her adrenals were crashing. So we put her on, her adrenals needed help. We put her on nutrition to boost her adrenals, all by way of examination, not by guessing, by checking. I did find some structural stress in her back that was affecting her legs. So I did do some chiropractic work to help her once or twice, which gave her some relief. But the combination of the nutritional program and her dietary modifications so that she's only eating good quality foods. We're helping her pull off sugars now. These types of things have catapulted her to where she walked in here today. Now she just got back from a cruise, and she was worried about being able to even stand on the cruise. Instead of that, she was running around the ship.
Oh my goodness, I was so active. And I just thank God. I'm so happy that I found the doctor, and my husband was able to get me out here, because now, as a result of coming here as well, I'm getting off of the heart medication.
Yes, she is.
And they had me on blood thinners. As a result of that. So now I'm completely off the blood thinner.
Now we're talking 6 weeks.
Right.
6 weeks.
I'm completely off the blood thinner.
So,
and now I'm working on getting off of the heart medication that they caused due to the albuterol.
Right.
So I'm just happy.
Are you okay?
But just talking about it puts me in. I'm saying, my goodness, what did that do?
She's good. So she's just, let's think about what you've done, not where you were. So
Mm-hmm.
fortunately, we were able to fix this for you, Linda. So you solved that problem.
Yes.
So you're out of the
Yes.
woods. You're okay.
Thank
And
God.
now you're in complete control of your body again.
Yes. And my energy, my sleep is good.
Yeah, that
I'm
was the thing.
sleeping all night.
Yeah, she wasn't sleeping, and she had terrible energy, and those two things are what she asked for. She wanted to be able to sleep, and she wanted her energy back. We've already achieved that, but now she's like, well, can you take me a step further and get me off all the meds? I said, sure, why not?
Yes.
We just need time for your body to heal.
Yes.
The other thing I want to mention is that she just does not live around the corner. How far are you from me?
I'm in Uniondale. It takes us over an hour.
Right, so she's in Nassau County, Long Island.
Yes.
I'm in Suffolk County, or mid-Suffolk, Long Island. So she has to travel pretty much, I don't know how many miles it is, but it's at least an hour in the car on the expressway to get here.
Yes.
And she makes it here, and she makes it here diligently.
And one other thing I want to bring out. After the first visit, I was giving out your cards to everybody because I limped in here and I walked out with no pain in my hip after having it for months.
Yeah, so, sometimes it's just a matter of getting the right thing, Linda, and then your body will do what it has to do.
Exactly.
And, it's nice to see, and again, I love the fact that Linda is over 50, because I talk to people every day, and they think because they're 50 or 60 or 70, they can't get well, and Linda's just having a ball. She feels great. And we just can't talk about the old stuff that you went through, because we're not going to bring that up anymore. You don't like that.
No, I don't like it at all. It doesn't agree with me. Right.
So, great story from Linda. We thank you so much for coming in and telling people about this, because when I tell people these stories, they don't believe me, and I want them to hear it right from you. I'm very proud of you, Linda. Well done.
Thank you so much.
And I look forward to helping Linda feel better even further. So out there, just listen up. There's always a way to get better when you know how. Have a great day. We'll talk to you later. Thanks again, Linda. I'll see you.
Bye-bye.